There's no shortage of harsh measures or threats of harsh measures against pregnant women who drink. But are these helping to accomplish the goal of healthier babies? That's the topic of this week's Healthcare Triage. In many areas of health policy, the best of intentions can lead to more harm than good. Such is the case with America's approach to alcohol and pregnancy. The best evidence shows that punitive policies, such as equating drinking while pregnant as child abuse and threatening to involve child protective services, can dissuade women from getting prenatal care. Fetal alcohol spectrum disorders refer to a collection of problems in babies and children. These include low birth weight, impaired growth, and problems in the heart, kidneys, and brain. Children can have developmental delays, communication difficulties, learning disabilities, and lower IQ. Some of these last a lifetime. It's hard to know how many American children are affected. Studies done by the Centers for Disease Control and Prevention have estimated that between 2 and 15 infants per 10,000 born in the United States have fetal alcohol syndrome, the most severe form of the disorder. Some community-based studies that use the broader definition of the disorder have found more affected children, up to 5%. We know that infants of women who drink alcohol in pregnancy may develop these disorders. The problem is what we don't know. We don't know the level of alcohol exposure in utero that could cause a child to develop these disorders. We don't know if the timing of the exposure matters. We don't know why some women who drink little might have a child who's affected, while some can binge drink during pregnancy and have a child with no apparent problems. Because of all of this, most medical organizations, including the American Academy of Pediatrics and the CDC, recommend that women forego alcohol during pregnancy. The only known dose to be safe is none, they say, and therefore women should not drink at all. Many women in the United States comply with this directive, but a significant number do not. A study published this April found that 11.5% of women who are pregnant report drinking alcohol. Almost 4% report binge drinking, defined as 4 or more drinks on any occasion in the last month. Given that women may be ashamed to acknowledge this, the true numbers may be higher. To combat this, 43 states have enacted policies to try and curb this drinking. These can be affirmative measures, like giving pregnant women priority for substance abuse treatment, or punitive ones, like defining drinking alcohol during pregnancy as child abuse or neglect. Proponents of such policies believe that they are making things better, especially for children. A recent study suggests they're wrong. Researchers gathered birth certificate data from more than 155 million live births from 1972 to 2015. The researchers were interested in how many children were born at a low birth weight or prematurely. They compared the rates of those undesirable outcomes in times and places when alcohol pregnancy policies did and did not exist. They controlled for a number of demographic and related factors, including those known to be associated with poorer birth outcomes like poverty and cigarette smoking. They found that policies which defined alcohol use during pregnancy as child abuse or neglect were associated with an increase of more than 12,000 preterm births. These early births led to more than $580 million in costs in the first year of life alone. Policies mandating warning signs where alcohol was sold were associated with an increase of more than 7,000 babies born at low birth weight at a cost of more than $150 million. A previous study looking at how these policies affected women's drinking found mixed results. States with punitive policies had more drinking, not less. Overall, neither type of policy seemed to be associated with lower levels of drinking. It's possible that states that already had more drinking might have put such policies in place in response to it. But the research methods used accounted for this, and state-level data on drinking and the prevalence of fetal alcohol spectrum disorders weren't available when most of these policies were enacted, making it hard to believe that the relative levels of problems were what spurred policymakers to act. Dr. Sarah Roberts, an associate professor of obstetrics and gynecology at the University of California, San Francisco, was an author of this study and other related work. Doctors have long discussed potential dangers with patients, one-on-one, with many benefits. But policies that punish women for or publicly warn them against harms from alcohol or drug use during pregnancy, she said, may lead to further harms by scaring women into foregoing prenatal care. Such policies may even convince them that talking with their physicians isn't a good idea. Quoting her here, qualitative research finds that pregnant women who use drugs avoid prenatal care out of fear that, if their providers find out about their drug use, they will be reported to Child Protective Services and lose their children. Our study found that child abuse neglect policies led to decreased prenatal care use. Other research confirms this hypothesis. 3 years ago, researchers, including me, published the findings of a survey on legal requirements for drug testing in prenatal care. Although most women were tolerant of laws requiring screening of pregnant women, 21% reported that they'd be offended if their doctors asked them about drug use as part of prenatal care, and 14% said that mandatory testing would discourage prenatal care attendance. It's that last bit that most concerns physicians. Avoiding medical care is not what we'd like to see happen. The goal of all of these policies is to improve the health, not only of pregnant women, but also of the children they bear. Many people assume that if physicians simply provide more information, if women are just warned, things will improve. Without research, these assumptions are just unproven hopes. Dr. Roberts had 2 suggestions for what might work better. The first, start over and go through a rigorous process of engaging with women who drink during pregnancy to find out from them what would help. Second, stop treating pregnancy as a special case when it comes to alcohol. Quoting her again, there is some evidence that general population alcohol policies, such as limiting where alcohol can be sold, are associated with improved birth outcomes. This makes sense, as research shows that the biggest predictor of drinking during pregnancy is drinking before pregnancy. Women don't start drinking during pregnancy. If they drink during pregnancy, it's usually a continuation of the way and the amount they were drinking prior to pregnancy. It might be better to spend time making sure that women are connected to the healthcare system in general and that they enter pregnancy healthy rather than focusing on the 9 months of pregnancy as if that's the only time that matters. It's easy to stigmatize women who drink during pregnancy with words and with policy. The goal, though, is healthier mothers and infants. To achieve that, policymakers may need to stop stigmatizing and start over. Hey, did you enjoy this video? You might also enjoy this video on alcohol, cancer, and how we think about risk. And if you like the show in general, it's really nice if you support it at patreon.com/healthcaretriage. We'd especially like to thank our research associate, Joe Sevitz, and of course, our Surgeon Admiral Sam. In my book, The Bad Food Bible, is still on sale in stores.